Today we are going to talk about the impact of generative AI to the different types of jobs in nurse. The use of AI within nursing can be traced back to the 1980s, when it was primarily used as a decision support system and expert system that aimed to mimic the judgment of nurses and doctors. Since then, AI has come a long way, boosting productivity and enhancing patient care by creating predictive models, chatbots, assistive robotics, and other forms of technological innovation. AI has revolutionized the nursing profession, allowing nurses access to quicker, more accurate data sets that can help to predict patients' outcomes, providing a deeper understanding of illnesses and better informed diagnosis of diseases. AI tools in nursing include clinical decision support, mobile health and sensor-based technologies, and voice assistance and robotics. These tools enhance nurses' abilities to make clinical decisions and may supply the end user with information or provide actionable options based on the data. The integration of AI within nursing education is transforming the way students learn and prepare for their future healthcare careers. Today, AI technologies are utilized in a variety of ways, from stimulating and analyzing patient conditions to providing personal feedback to individual students. These advancements in technology offer nursing students the opportunity to hone their critical thinking and clinical decision-making skills, all while receiving real-time feedback and support from AI-powered resources. So we are from the School of Nursing. Currently, we are studying the course of Bachelor Science in Nursing, which is the code of 35455. The purpose of the video is the impact of generative AI to different jobs in nursing. Therefore, we'll now discuss the following impact in details. The first impact in nursing is the support of clinical decisions. Nurses have a tremendous amount of workload, therefore nurses may need a long time to checklist of the patient. Since generative AI enhances nurses' ability to make clinical decisions, nurses can provide quicker and more responsive answers for patients. For example, AI will auto-generate nursing diagnosis for risk prediction, guided decision trees, and automatic warning system. These functions allow nurses to reduce their workload and cater the needs of different patients.
In addition to clinical decision support, efficiency and workflow in nursing can also be enhanced. It has been found that generative AI can help clinicians make informed decisions effectively and quickly by combining predictive analytics capability with data from other sources, thereby helping nurses identify patient at risk of life-threatening heart rhythm disorders. Moreover, robust clinical prediction will also be provided by AI in order to enhance efficiency in nursing. From my own personal experience, my aunt, who is a nurse, told me that there are AI application in hospitals that help them identify patients with life-threatening heart rhythm disorder to foster the workflow.
Generative AI is transforming healthcare by analyzing patients' data, including medical history and lab results, to create personalized care plans. It can provide tailored recommendations for nursing interventions, taking into account comorbidities and potential drug interactions. AI can even calculate medication dosages accurately. Beyond individual care, AI can predict patient level and optimize staffing schedules, leading to more efficient resource allocation. This technology is enabling a new level of personalized, efficient care in our healthcare system.
I'm Chen Cheng. Generative AI can help a lot of jobs, just like nurse. Generative AI can assist with patient care and become integral for addressing a host of common needs of patients to reduce the pressure of nurse. For example, AI can help personalizing medicine, analyzing medical images, taking clinical notes. From my own experience, many nurses in hospitals can utilize AI to assist them to monitor patient signs and detect any abnormalities of patients. AI can alleviate the pressure and heavy workloads of nurse who has to deal with unaccountable patients every day.
This is Chao Qilan. The impact of AI in nursing also includes the alleviation of healthcare challenges. Generative AI can potentially address a vast amount of healthcare challenges by the involvement in clinical decision-making, risk prediction of pandemic preparedness, and improved drug discovery and development. Moreover, AI can provide personalized medications and care. All of these could contribute to the reduced in time to diagnosis and the increase in accuracy of medical intervention, fostering the recovery of patients.
We are going to discuss the news related to the impact of AI in nursing. The partnership of Google and Mayo Clinic creates a new application of technology throughout the nursing sector. As AI has the benefit of providing real-time data and streamlined tasks, nurses can rely on these center technologies to reduce their stress so that nurses can focus on tasks that require their expertise. However, this technology still requires human oversight to protect the safety of the patients. Besides the collaboration, Google Cloud next is collaborating with HCA Healthcare to reduce the burdens of nurses and doctors by adopting generative AI in administrative tasks. This creates an efficient system in the healthcare sector. This is the prompt. So we are now going to talk about the challenges and concerns. The prompt is impact of generative AI in nursing. We have encountered two problems, which is not holistic explanation from AI sources, and there are few statistics or real-life examples to illustrate the points.
To solidify our views, we have interviewed a student who is studying both AIDA and nursing. Let's hear what he has said.
So one of the main challenges that I may encounter is how to ensure the quality, the accuracy, and the reliability of the generative content. How can I verify that the content is not biased, misleading, or harmful?
These are the challenges and concerns. Prompt. The ethic of misuse of AI is one of the challenges and concerns. AI systems are trained on existing sources, including unverified ones on the internet. They can potentially provide misleading, inaccurate, or fake information. Moreover, it breaches of privacy, as AI systems often require substantial amounts of personal data to function effectively. Violation of privacy of this data can be misused if it falls into the wrong hands or is not properly secured. Thirdly, the lack of transparency in the AI system, especially those based on deep learning, can be black boxes, making it difficult to understand how they make decisions. This lack of transparency can lead to ethical issues, especially when AI is used in critical areas like healthcare or criminal justice. At last, the weaponization of AI is concerned about the potential misuse of AI in warfare, such as autonomous weapons that can make life or death decisions without human intervention. This raises serious ethical and safety concerns. Prompt used in ethics and concerns are these, and I have encountered some problems such as having similar points which does not benefit to me to brainstorm or give new examples, and having few to no explanations. This causes me to understand the context based on my own knowledge and further in-depth searching related to the topic, which is very inconvenient. The solution is to read related articles and conclude useful resources. From my personal experiences, the AI chooses many suitable points, and types many prompts to get good results, and focus heavily on Western countries' results.
Apart from meeting the ethics and misuse challenge, quality control challenge has also been raised. First, the problem of poor data quality and bias may arise. Since AI models heavily rely on large amounts of data for training, and if the data used is of low quality or bias, it can lead to inaccurate or biased prediction. Especially healthcare data can be complex, incomplete, or contain errors, which can impact the performance and reliability of AI systems. Moreover, AI lacks interpretability in the nursing field. Many AI models, for example, deep learning algorithms, are often considered black boxes because they lack interpretability. Understanding how and why an AI system reaches a particular decision or prediction is crucial in the healthcare domain, where explainability and transparency are essential for gaining trust and ensuring patient safety. However, when requesting AI-generated responses, certain issues such as the lack of explanation and redundant content often arise. Consequently, to ensure a more precise and concise presentation, as well as to enhance the quality of the content, I have thoroughly analyzed the AI's responses. Based on this analysis, I further summarized and interpreted the information to refine the presentation. By doing so, I aim to provide a more coherent and comprehensive presentation of the subject matter.
Besides, generative AI is poised to revolutionize the healthcare industry, but it also brings significant challenges, particularly in terms of job displacement. Firstly, AI can automate many tasks, such as data entry and analysis, potentially displacing administrative roles. Secondly, the ability of AI to perform complex tasks like medical image analysis or disease prediction could reduce the need for specialized doctors or technicians, leading to further job displacement. Lastly, the use of AI could change the nature of jobs in healthcare. Doctors and nurses might spend less time on diagnosis and more time on patient care, which could displace those unable to adapt to these new roles. We could see that the ChatGPT-4 has raised several ways that Gen AI could affect healthcare industry. However, without a clear elaboration in Comp 4 and 7, which covers the ethical concerns and privacy matters, both of them are not related to job displacement. Therefore, I asked the ChatGPT-4 to further elaborate in a more precise way. Eventually, it will generate a more close and clear answer related to job displacement.
There is another underlying concern when using AI to help us, which is copyright issue, such as plagiarism, deepfakes, and legal framework. When I am using AI to help me to generate the copyright problems, using the prompt leads some copyright issue concerns when we are using generative AI to assist our job. While there are some troubles when using AI, we can see that AI gives some points are similar. Almost all of them are about plagiarism problems, but it doesn't mention the others. And some of it are not related to the copyright issue, just like the first point in the test, which is about data training of teaching AI not to use copyrighted materials. Points from AI are not clear enough, such as it mentioned that it is allowed limited use of copyrighted material without permission, but AI doesn't mention which type of material can be used. Therefore, in order to solve these kind of problems, we can use a more accurate prompt to ask AI to give response, or use GPT-4, a more advanced version, to finish the task.
For data security risks, there are concerns on data privacy, data leakage, and intellectual property theft. They are mostly caused by the access of AI to big data and the ability of AI to generate realistic image without any restraints. Here are the problems I face while using generative AI and the strategies I used when encountering the problems.
And now we are going to talk about the conclusion. To sum up, there are several impacts and challenges of artificial intelligence, which brings impact to nursing. AI helps nurses to have a more convenient environment to work in. Hence, this reduces the workload of the nurses. However, nurses should not totally rely on AI's judgment, as it may provide misleading information and not holistic decisions. Therefore, as modern-day nurses, we should use the advantages of AI and minimize the effect of the disadvantages. Lastly, in this project, we have used a variety of Gen AI tools to help us finish the project, including ChatGPT, Bing AI, Llama, Playground AI, and Midjourney. This is the end of our presentation. Thank you.